For those of you who are on the wiki, you can see the question. Sorry, Angela, I'm having trouble hearing. I'll just read the question to you. So from Dr. Guy Gennon, he says, very nice model and integration with imaging. The effect of stress on diffusion is a key aspect that you have put into your model to enable patient-specific modeling. Could you say a few words about why one can neglect dilational effects on the diffusion coefficient? That is, why is it appropriate to use von Mies equivalent stress? Thanks.
Actually, that's a really good question, and I'm not the one to ask that question, unfortunately. So I can tell you that when they first developed the model to include the von Mises stress tensor, this was really a first try, and we acknowledge that it's probably not totally accurate, and there are other probably ways to incorporate those stresses in probably more elegantly. But for now, it seems to be holding up, and I can tell you that there are several people in the lab that have been looking at updating the stress and updating how we mechanically couple. So that's a really great question, and I appreciate that question.
Okay, the second question is from Bill Litton, Dr. Bill Litton. Do you have any thoughts on how to include chemo-RX side effects so as to identify regimes that would minimize these?
Yes. So one of the things that our group is actively looking into right now is optimal control theory. So the idea is that using optimal control theory that we could incorporate side effects and other constraints on the solutions of these regimens that would be the optimal for an individual patient. So we're really hopeful that we'll be able to incorporate those adverse effects. So absolutely, that's definitely on the docket and something where we want to consider for individualizing patient therapy.
Okay, next question. Great talk. The different therapies, smaller dose over time, give very different results for each patient. Is there a reason for this response that can be learned from the data? Is there an underlying feature in the MR images that can explain which therapy will do better?
So yeah, when we started to see these results, we started to dig into that. Basically, there's a difference in the physiology of these tumors, so how well perfused the tumors are. And there are different regimes where certain patients, a high dose will get in there and it will retain in the tissue versus a low dose will get in and it doesn't retain at all, and everything in the middle. So really that difference in vasculature within these tumors is a big deal. And I'll note that because we don't have an evolving vasculature right now, we're not even considering the fact that these chemotherapies really do damage to the vasculature. So potentially we could, having lower dosages, the vasculature could improve and perhaps improve the delivery of these drugs. So yeah, absolutely. I think I've answered the questions. I can't remember exactly the full question now.
Okay, thank you, Angela. I think we have, if you look on the IMAG wiki for your page, you have many more questions to answer. So you're welcome to go on and just hit reply to each of the specific questions. So then your responses will appear underneath. And actually for the ones you've already answered, you can also hit reply. These pages will be archived, so your questions and answers will be saved for future viewing as well.